Hi friends. In this video, let us see about the types of medical data that will be recorded by every EMR or EHR software package. First is demographic data. It includes all the non-clinical data related to a patient, like the data that uniquely identifies that patient. For example, his name, age, his sex, address, then the insurance type he is holding, then his native language, his religion, his family structure, etc. Then comes the vital signs. So these are a set of measurements that the doctor uses to assess a patient's physical health when he visits the hospital for the first time, or when he comes for a follow up, or when he's admitted, etc. So these include his height, weight, then his pulse rate, then the body temperature, respiration rate, and all these stuff. Next comes the medication. So these includes the set of medicines that the patient is presently consuming on a daily basis in his life. For example, he may be suffering from any chronic illness like diabetes or any other specific skin problem or something. So he'll be consuming that medicines. So the doctor will be taking a note of all the medications name along with its dosage and frequency, and then it also includes the set of other medicines that the patient is consuming, like Ayurveda or some other thing other than allopathy. And this also includes whether the patient is consuming alcohol or smoking or the details. So, in general, other than food, what are the extra things that the patient is consuming that will be included here? And then comes the lab test. So, these tests include the medical procedures that take a sample of the patient's blood or urine and identify his basic condition. So, to diagnose any specific illness, and based on that, they'll plan the treatment, and they'll also be checking if the treatment is working by periodically taking a sample of his blood or urine. Then comes the pathology. This also falls into the lab test category, but here it involves us specifically studying about a particular disease, like the qualitative and quantitative examination of any body tissue. For example, if you are suffering from dengue fever, every 10 days or every 2 weeks, they'll be taking your blood test and see the platelets growth, whether it has reduced. Only then the doctor will be say, okay, now your disease is, okay, now you are recovering from the disease. Oh no, now uh, your disease is getting severe now. So all these details, like based on the cell surface antigens or samples, biopsy samples. Then comes the microbiology. So this includes testing the specimen from the patients to see for any growth in microorganisms, like from our urine culture or some blood tissues. They see the growth of any microorganism. For example, a track of it. Also, it can be used to test the sensitivity of our body to various antibiotics before the doctor is prescribing us any new medicine for a particular illness. Then comes the medical notes. It includes some accurate and complete documentation about a patient's medical history, and if I have been admitted to a particular hospital for treating my typhoid disease, the discharge summary, it will include when I was admitted, when I got discharged, and the reason for which I got admitted, and how my body, what are my vital signs, what the lab report said about me, all these details, and the current medicines that I have been already consuming, and then how the doctor has diagnosed my illness, what treatment plan they used, and how how well my body recovered, like what the time period it took, and the follow-up plan they have scheduled for me. All these details will be mentioned in a discharge summary. So these also includes the additional notes taken about us by the attending resident or the nurse or any particular specialist. Like when we are admitted, so many doctors other than the chief doctor, other doctors or other nurses, they'll be coming and checking us, right? So they'll also be taking a note about us. All these details will also be a part of the medical notes. Then comes the billing data. The hospital will be tracking, it will be storing all the billing data about us, right from consulting the doctor, then the prescriptions. for the medicines that we are consuming and also for the lab test we are taking. All these details will be tracked very neatly, because they have to collect the money from us, or from the, if we are having an insurance policy, they should claim that money from the insurance provider, right? So they'll track it very perfectly. And then comes the imaging data. This is a process that takes picture of the areas inside our body. The radiologist will be doing it, and then he will be sending a report about the findings and conclusions by looking at the medical images taken during our test. It includes taking an X-ray if our any hand or leg gets fractured, and then if we are pregnant, they'll be taking ultrasound scan, and if we were a COVID patient, they would have taken the scan of our lungs to see how it is functioning, etc. And then comes the quantified self data. These includes the vital signs about us that we are monitoring, that the patient is monitoring about himself on his phone, like using his mobile phone or using a smartwatch, etc. Like we know, right, from our mobile phone or some our smartwatch, we'll be knowing our heart rate, our blood or weight details. Will be tracking it on our mobile phone. Then the activities, like the steps we are taking, like the how many minutes we are doing workout every day. So these details will be taking note on our own. These details will also be a part of a medical data. So these are the common medical details that are stored in any hospital healthcare system. um I hope you all understood it. Thank you.